While fast blood sugar will tell you how much contents does this individual conserve in his or her bloodstream when she doesn't take in anything. It shall imply that insulin productivity, is it resistant? Is it reduced? Or insulin inadequacy, does it still exist? That's why we need fast blood sugar as well as random blood sugar. The home one is the one that we call hemoglobin A1C, which will evaluate both these two tests. That's how we diagnose diabetes mellitus.
So on the sample collection, is it blood or urine?
We collect blood. We don't take urine when we are diagnosing diabetes mellitus. However, the urine of the patient of diabetes mellitus has got high volume of glucose, and it is shown on the litmus paper.
Okay.
Sure.
All right. Now, is this disease treatable? Is there any treatment for diabetes?
There is a treatment, but diabetes will never get cured because, as I said already, that there are predisposing factors as well as the causes. The causes are two, predisposing factors there are many. So, treatment we give according to the presentation of the patient. We have good medication. Number one is oral hypoglycemics. We give what we call metformin as well as, most of the time, we give metformin. Metformin, glibenclamide, those are drugs that are sulfonamides. Those are the drugs that we give. And in extent whereby we have got insulin being resistant, then we give insulin therapy. And this insulin is given at, most of the time, subcutaneous tissues. And the one who is supposed to be taught on how the patient must know where the subcutaneous tissue of any muscles. It can be deltoid muscle, it can be the triceps muscle, but it should be subcutaneous. Insulin therapy, that is in a condition whereby there is an issue of insulin resistance. Where we have got the GBL1 receptor antagonist, we can give them as well. Whereby in this case we are talking about, if we say GBL1 resistant agonist, it shall mean it's glucose resistant profiles 1 resistant, is being against the insulin. As such, we need to give them this kind of therapy. That's number one treatment, is medication. Number two treatment is lifestyle modification. How are we doing to do it? We need to have a healthy diet. Make sure we improve on how we are eating. Don't eat to live, but live to eat. Regular exercises. Make sure you have some time that you walk on foot or whatever you do. Weight measurement, using basal measure weight in nutritional rehabilitation unit, NRU. Make sure that you weigh yourself with using a calibrated balance of the weight. You must regulate your weight. If you are too overweight, that shall mean you are going to obese. Obese have got a very good example of tragedy to diabetes. Stress reduction. How are you going to reduce stress? There's nothing than taking alcohol or taking tobacco as a matter of reducing stress. Stress will deplete all your energy. That shall mean the resistance of insulin will have a very good impact on you. As such, the chances for you to develop diabetes is very high. Same like you have to know that blood glucose monitoring is very important. Sometimes you just need to know how much do I have in my blood. Just to go to the hospital and take care of those kind of blood glucose monitor. Medication adherence. Make sure if you have been in the situation whereby you have been diagnosed with diabetes, you adhere to medication. Follow all instructions given from the medical personnel. Then regular checkups with a healthcare provider. How are you going to do it? Come on this date. Make sure you respect that date. Go and have a very good thorough checkup. Whatever you are facing, explain to the doctors so that they can help you. Food care and wound prevention. That's another management whereby where you have got a wound, make sure you don't need to hide it. Say to the right individual, and they have to be in a position of telling you on how to prevent it. And that wound must be taken care of. Where necessary, debridement is necessary, accept debridement. Where necessary, they need to exercise or to cut it out. Accept it, because if you leave the diabetic foot without management, it will end up trying to arise up and it will develop into cancer cells. Number 3 is vaccination. How should we be vaccinated? Those vaccines are very important. We need to vaccinate all individuals in terms of those guys who have got flu or even pneumonia. We need to prevent those kind of things. So those are part and parcel on how we can manage or treatment of the diabetes mellitus. So I said medication, number 1. Number 2 is lifestyle, as well as all other things that I have been saying in terms of treatment of diabetes mellitus. Sure.
All right, our listeners, we need to monitor our lifestyle. In case you're just joining us, in today's episode, we are discussing diabetes with our guest, Dr. Josam, Gift Josam. All right, now, how can we prevent this medical condition?
As I have already said that diabetes is about the sugar contents in the bloodstream. So prevention measures, I think we can just peruse them. However, the above there has been already mentioned. However, the most important thing is we have to maintain our healthy weight. Make sure you don't be too fat. If you are too fat, you are giving the cells to have a lot of work in terms of controlling of insulin. As such, we have to maintain. Don't eat to live, live to eat. Engage in regular physical exercise. Gymnastics is very important. In life, we need to have some, we need to do some gymnastics. Exercise very important. Those things, they reflect all the other avenues of our bodies. Such it is very important that we keep to be keeping on making physical activities or exercises. Eat balanced diet. When people they believe that when they're having a lot of food on their table is when they are eating well. No. If you are having nsima, 7 tanders of nsima doesn't correct that you are eating balanced diet meals. No. You need to balance having vegetables, small things. Don't just eat anyhow. Balance things that it should be in your system. Avoid smoking. Smoking has got in the tobacco there's a nicotine. Nicotine controls or it narrows the vessels of the arteries as well as the veins. If you are controlling these kind of things, expect nothing but flow of the glucose or flow of insulin itself to the right position. It won't pass because that nicotine will block the arteries. As such, if it is blocked, you form the emboli, which will complicate other things. As such, it is important to avoid those kind of things. Limit alcohol consumption. If you are taking a lot of alcohol, it will make you to be on the list of catching this kind of disease, because alcohol again has got a lot of sugar. Most of the alcohol they are made from sugar, because the basis of alcohol is fermentation. fermentation to take place, it needs acid as well as sugar. That is basing according to the elementary secondary school of chemistry. So all those are markers that we need to prevent so that we don't have those kind of condition of diabetes.
All right, Mr. Josam. As we are winding up our program, is there anything that you wanted to let the audience know about diabetes?
Yes, for sure. I just want to put some emphasis on the clinical presentation of diabetes mellitus. When you come to hospital medical setup, the medical officer or anyone else who is controlling you will tell you the following. There are 3 P's that we respect in as far as diabetes is concerned: polyuria, polydipsia, and polyphagia. These 3 P's, they are controlling markers on how you can diagnose diabetes without using any tests. The patient will tell you that the polyuria, it shall entail continuous urination. The patient will urinate now and then. If the patient tells you like so, even your relative and whom you see him or her having a lot of age to have urination, that's one clinical presentation of the diabetes mellitus. Polyphagia, tiredness of individual. The individual will be so we experience a lot of fatigue now and then. Why? The sugar is not going to the right position because the insulin is not doing its job. It is being produced inadequacy, or it is in addition to again cells that are responsible for the job. The base mellitus, which is very difficult, is genetic. The one most of the time it attacks the ladies when they are pregnant. That one will develop into nothing but microsomic baby. When the baby is too big, cannot pass via the mother's vulva. As such, the mother is at risk of developing some complication. For example, this diabetes might develop into heart disease and stroke, as well as kidney disease, nephropathy, because the kidney is not functioning well and supply of the glucose to the kidney is not okay. As such, we expect nothing but kidney disease. Nerve damage, as I said already, that you can have some optic or blood vision because these things, it attacks the optic nerve. So that optic nerve is not well supplied of the blood. As such, is not well supplied of the glucose. As such, it becomes inflamed. In so doing, we expect nothing but neuropathy, and that is nerve damage. Blindness, I said already, it goes to optic nerve. Foot damage, it becomes because there's no sensation going to the position whereby even the antibodies, they cannot go there because there is no any glucose being there. As such, it is very, very, very important that it should be done in the correct decorum manner. And number 3 is about the cognitive impairment. The cognitive impairment is coming because the glucose is not going well to the brain. As such, the thinking capacity will become demoralized. Thus, those are things that can be complicated to diabetes mellitus.
All right, Mr. Josam. Let me thank you for coming here to explain how diabetes is caused, how to prevent it, how it can be, the causes, and how can someone catch this medical condition. This marks the end of our discussion today. You were with me, Liveness Ntioka, and this marks the end of our discussion. Our guest today was Mr. Gift Josam. And you were with me, Liveness Mchoka, the producer and the editor of this program. Till we meet again in the next episode, as we'll be coming with another topic to discuss. Bye.